Hi everybody, I'm Palak from the tribe Unstoppables, and today I'm going to be presenting the USA's suggestions and views on the Cox's Bazaar COVID-19 outbreak. Recently, WHO changed the COVID-19 variant in the Cox's Bazaar, its status from variant of interest to a variant of concern. We strongly believe that better intensive care facilities should be provided in the Bazaar, as the current status is that there are only 10 ICU beds available for 1.2 million inhabitants. Myanmar and Bangladesh should come forward and request for funds from the UNFPA, that is the United Nations Population Fund. According to WHO, a minimum of 4.5 physicians and nurses should be available to 1,000 people. But according to the current status at the Cox's Bazaar, only 0.31 physicians and 0.12 nurses are available to treat 1,000 people. Essential commodities should be provided to the refugees so that they don't have to move out of their houses and get themselves infected. This would reduce the load on the medical system there. Regulations should be put on antibiotics available so that an epidemic like the black fungus doesn't break out. A classic example is the outbreak of the black fungus in India due to excess use of antibiotics. After the arrival of screened patients, they should be strictly instructed to sanitize their hands, shoes and sandals, and also wash them before sanitization. Vaccination camps should be set up at the Cox's Bazaar. Like USA, they should also try to vaccinate maximum people so that people don't get severely infected and not a lot of people die. Unaffected refugees who are identified as citizens of Myanmar should be warmly welcomed back in Myanmar. If they stay there, the tendency of getting infected increases naturally. Maternity units providing essential health services to pregnant and lactating women should be set up so that they don't get infected as they are more vulnerable. Help should be provided to the Rohingyas via field hospitals and health centers. Hotspots within the bazaar should be identified, marked, and most importantly sealed. The testing should be ramped up at the Cox's Bazaar so that there's early detection and not a lot of young lives are lost. PPE should be provided to all the healthcare workers working there, and good masks should be provided to the refugees so that not any of them get infected. We strongly believe that, like us, the vaccination and the testing camps are the two most important things that should be ramped up there. If they make this possible, then they can probably curb this outbreak at the Cox's Bazaar. Thank you.